Hello, I'm Dr. Daniel Farkas, and I want to welcome you to the Adrenal Recovery Academy, brought to you by Back to Health Natural Solutions. I'd like to start with my story. Again, my name is Dr. Daniel Farkas, and in 2016, I woke up from hernia repair surgery, and I knew something wasn't right. I couldn't get my thoughts together, and I felt panicked. I figured it was a result of the anesthesia at first. I was transported home and I tried to rest and calm my mind down. I had had a hernia surgery before as well as knee surgery, so I couldn't understand what I was experiencing. Before I knew it, 2 weeks had passed by with virtually zero sleep. Worst of all, I did not know when this spaced out, unbelievably tired feeling would end. Now, gratefully, I had help from the alternative medicine community, and I went to see a special type of doctor called a functional medicine doctor. I skipped the ordinary medical approach as I was certain I would just be given a prescription, which I feared at that point as the recent medical procedure had plunged me into an unending, anxious, sleepless trance. I was glad when I was told that a simple test could tell me what happened. I took the test kit I was given, I went home, I collected 4 small saliva samples the next day, dropped my samples off for shipping, and waited. Still, the bizarre symptoms persisted. I wondered if I had gotten brain damage during the procedure from lack of oxygen. Within a week, I had results. The verdict? Severe adrenal fatigue. The hernia pain leading up to the surgery had worn down my stress-fighting mechanism, and the surgery itself pushed me over the edge. My brain had wisely decided to try to return me back to a state of complete inactivity while it recovered. The problem was that I was not recovering, but was instead stuck in adrenal fatigue quicksand. Now, my functional medicine doctor said, "Don't worry, I had this too. You will recover. And along the way, you will learn a lot about how to help other people with this condition." Well, he was right. After a few weeks of some natural herbal support, a simple but structured eating strategy, and some improved sleeping habits, I felt 80% better. And after 3 months, I was back to exercising and most importantly, sleeping normally. The miserable anxiety and confusion were gone, and as he mentioned, I had learned a lot along the way, which has served many of my clients in their own recovery. So, what is adrenal fatigue and how is it hurting you? Now, adrenal fatigue is a condition in which abnormal amounts of the stress hormone cortisol are secreted, which can put your body into a frenzied state of overdrive or make you feel like an absolute zombie, incapable of sleep, work, movement, or any enjoyment whatsoever. Please understand that this condition is not recognized by the traditional medical community. The medical community sometimes refers to this condition as a thyroid condition, a stress overload problem, or as simple anxiety depression. Again, popular healthcare does not recognize, test for, or treat the cause of adrenal dysfunction classically. This is strange because it can be diagnosed with simple but specialized testing. Attached to this message or attached to this document, there'll be a simple link, possibly in the description, to an adrenal stress test. Please look at your accompanying materials. Now, in this course, we will look to show you how to recover from adrenal dysfunction. This can be done naturally without using supplements or testing. We have found, though, that testing using a relatively inexpensive, simple home saliva test helps to pinpoint the severity of the condition and can help you to recover faster. All natural support using specific herbs and vitamins also can give your body critical support to accelerate healing. Understand that anyone who is diligent can recover with or without testing and supplementation. But here's a note, serious cases of adrenal fatigue can be pretty complex and do sometimes require professional management. So let's talk about the basics. Now, ideally, you would eat enough balanced food at regular intervals through the day to meet all of the needs of your body and brain. Your eating choices and timing determine your blood sugar, which is like fuel, levels. Now, blood sugar is like your steady, every 2 weeks paycheck that should hopefully meet the demands of your life. Cortisol is secreted by 2 little almond-sized glands called the adrenal glands that sit just on top of the kidneys. Now, cortisol helps to keep blood sugar steady. This is the backup plan for when blood sugar is not sufficient to meet the demands of life. It is like a high interest rate credit card that should be paid back regularly in full every month. Have you ever had a credit card balance issue? Well, ordinarily, your blood sugar is steady throughout the day as you eat normally, and your body usually only needs cortisol in the morning to prime your metabolism to get you moving. Now, when blood sugar is too low, the brain will tell the adrenals to secrete cortisol, which travels to the liver and asks for the stored blood sugar that the liver has. This back and forth flow works well under normal stress conditions. Now, remember, simple but powerful testing can confirm if things are working well by getting 4 saliva samples through the course of a day. And here is an example of a normal adrenal output. You can see each black dot is a saliva sample taken through the course of the day. Now, unfortunately, acute or chronic stress can cause the adrenal output to become either too much or not enough. This is called low cortisol output. This is true adrenal fatigue. Now, when the output is too high, you can feel hyped up, wired up, anxious, and have issues relaxing or sleeping normally through the night. Your brain can't live in this state forever, just like you can't live on credit cards forever. Eventually, the brain will stop asking the adrenals to secrete cortisol. This leaves you in a depleted state with no backup plan, just like you having spent your paycheck, your credit cards are maxed out, and you still need money for food, gas, and rent. This depleted state is adrenal fatigue, which can make you feel like the living dead stuck in living hell. Adrenal fatigue follows initial high cortisol output. The process can happen quickly or even over years' time. Understand that there are other systems in the body that create hormones as well that regulate how your body works. There are 2 main other hormonal systems. The first system is the sex hormone system, which makes the female hormones, estrogen and progesterone, as well as the male hormone, testosterone. Now, the second system is the thyroid hormone system, which makes thyroid hormone that every cell in your body needs for energy. Now, attached is going to be some information on some advanced home testing that assesses the sex and stress hormones and their interactions with each other. A link should be attached to this presentation or in the description. If you feel or you know that you have issues with your thyroid or sex hormone systems, advanced home tests may reveal what ordinary tests are not telling you. So let's talk now about what causes adrenal fatigue, low cortisol or output. Simply stated, it's just like a maxed out credit card. Maxed out credit cards happen when our spending exceeds our income. Never before has life been as stressful. Electronic communication, negative imagery, complex, evolving male and female roles, toxins, and global unrest are at historic highs. Due to the environment we must live in, we are all relentlessly exposed to some of the following: chronic emotional stress, acute emotional stress, surgery, trauma, emotional and physical, difficult menstruation cycles, menopausal hormone fluctuation, prescription thyroid medication, improper supplementation from guessing, and toxins and stimulants that just are present in a typical diet. Also from digestive disorders. These are directly related to stress-induced health problems like adrenal dysfunction. Attached is some information on an advanced home test kit that can give advanced information into digestive function. You may see it listed as something called a simple GI map. And also another common cause, leaky gut syndrome. This allows irritating substances to get into your bloodstream that cause chaos in your body. Attached also is a link and information to something called the leaky gut test. It also might be listed as a zonulin test for leaky gut syndrome. All of these are crucial, very, very important causes. So how do you know if you have abnormal adrenal output? Now, understand that adrenal fatigue is a pattern of symptoms which can make you a candidate for numerous medications looking to quote-unquote treat the symptoms of adrenal fatigue. If you feel that you have the pattern of adrenal dysfunction and exhibit some of the signs and symptoms I'm going to describe here, you likely have at least some type of adrenal dysfunction. Now consider which of these may apply to you. Are you tired when you wake up? You have sugar cravings, have irritability, anxious, exhausted, have insomnia, have salt cravings, have heart palpitations, have low blood pressure, cannot handle stress, have hypoglycemia, which is low blood sugar, have low libido, which is low sex drive, or have unexplained weight gain that you cannot get rid of, have irregular menses, like PMS, cramps, spotting, emotional trouble around your cycle, have reduced exercise capacity, you just can't work out, always feel cold, you have low thyroid function, or you have low energy despite using thyroid medication, or the thyroid medication keeps needing to be increased. You have PMS despite medications or hormone replacement. You have inflammation or pain throughout the body without a trauma being the cause, or you just feel spaced out at certain times of the day, or you require a nap to get through the day. Now, you must know the difference between high versus low cortisol recovery plans. Super important. You must understand the enormous difference between having too much cortisol versus too little cortisol. If your cortisol is already too high and you stimulate the adrenals further, you will feel worse. Understand that high cortisol is not adrenal fatigue. It is a state of overactivity of the adrenal glands and still must be addressed. Now, this is easier to help than true low cortisol output and adrenal fatigue. Now, if your cortisol is in a state of true adrenal fatigue and you decrease its output even more, you will feel worse. Assessing yourself honestly or asking family, friends, or coworkers for their honest opinion can be helpful, but remember, if you are wired up and cannot seem to ever slow down, you have recent unexplainable weight gain, and you feel overly energized in an uncomfortable way, you likely have high cortisol. Conversely, if you have fatigue, can't focus, have cravings, cannot get any quality sleep, or rely on stimulants, you likely have low cortisol and adrenal fatigue. Again, we feel you can recover without testing your supplements, but if you want to be certain, please consider a simple but powerful home saliva cortisol test. Link is attached. Now, what else can happen? Adrenal fatigue puts stress on other systems of the body. We mentioned the thyroid hormonal system as well as the sex hormonal system. These two systems oftentimes struggle to try to make up for what the adrenals are not able to do. This creates problems within these systems and often causes abnormal levels of thyroid or sex hormones, resulting in further dysfunction. So how do you know if you have issues with the other two systems? The gold standard to assess sex hormones and the stress hormone levels together is by using an advanced dried urine test. There's a link attached. You can also use traditional thyroid blood tests to assess thyroid hormone levels, such as TSH, T4, T3, and the thyroid antibodies. Be sure you get to check all of these factors. Make sure they're all being assessed. It is critical to know if you have any autoimmune condition associated with elevated thyroid antibodies, though not all ordinary doctors are willing to order this complete test. There's a link attached to an advanced thyroid home test. Now, please understand that most often it requires a specially trained functional medicine doctor to interpret these results in order to create an effective, all-natural recovery plan. If you need help, please contact us. Well, should you start addressing your adrenal function or dysfunction? It can be hard to focus, even harder to follow through, even to make this decision. Be sure to get support, seriously. You can contact us anytime for help, no matter where you live, if you want professional guidance and support. But no matter what, start slow. Go with half doses if you're using supplementation. Do not be afraid to cut things in half or to open capsules. There is no cookie-cutter approach to this. Every journey to recovery begins with a step, and we encourage you to take even the smallest step at first. Now, if after looking at the list of symptoms above you feel you may have some degree of adrenal dysfunction, we suggest starting with mild treatment and watching for improvement over a few weeks' time, 3 weeks' time. Please don't hesitate to do this along with consulting your medical provider in order to rule out other serious concerns. These are rare, but we do want to list them. Severely high vitamin B6 in your blood. This is rare, but it can cause problems mimicking adrenal fatigue. Drug or alcohol abuse, please seek help. Goiter. This is swelling of the throat and/or thyroid gland. Please have your doctor examine you for this. If you have sudden weight loss, large amounts, please visit your doctor. Any type of fever, and of course hallucinations or hearing voices or thoughts of harm to self or others, please seek professional help. Now, what not to do? First of all, don't rush it, as recovery can take 3 weeks, 3 months, or more. Do not begin any whole body wellness detoxification programs, please. And do not exercise aggressively. Also, do not just lay in bed. Have different areas for waking hours and sleeping hours. Do not self-treat with random supplements and vitamins. Can't stress that enough. Definitely do not guess with random adrenal boosting supplements. Really important though, do not let a healthcare provider ignore this potential diagnosis, which can be proved with a saliva test. They may just try to medicate your symptoms with thyroid medications, pain pills, sleep pills, antidepressants, and more. And sometimes these are temporarily necessary, but it is rare, and they virtually never help to balance the adrenals, but they can just make everything worse. So, the recovery process, 3 weeks to 3 months, or never if you choose to not recover. We would like for you to recover. You will recover, but right now you are ill to some degree. Acceptance is crucial and will spark the need for action. Be wary of falling into the trap of self-pity, which inhibits action. We have seen complete recovery by using zero supplementation and without the use of testing. By following items 1 through 8 below diligently, you can expect slow, steady recovery with improvement seen by 3 weeks' time typically, and significant return to normal activity by 3 months. You must address every item listed 1 through 8. Skipping anything will seriously inhibit recovery. Now, if you choose to benefit from initial testing and supplementation, please adhere closely to items 9 to 10 listed below. Item 1. Blood sugar and diet. To me, this is the most important part of recovery. You must show your brain that you will provide steady blood sugar so that it will slowly return to balance. During this time, you must avoid what are called high glycemic index foods that spike blood sugar, which spikes cortisol and worsens your problem. Now, here's a hint. Avoid fruits eaten all by themselves, except any organic berry. Blueberry, blackberry, strawberry, or raspberry. And you can have any organic green apples. All other fruits eaten by themselves are like eating a candy bar. And after years of practice, here are the best recommendations that I found for eating. You must intake steady energy sources. This is crucial. You must intake a steady energy source, and you must eat 3 regular meals per day. No skipping breakfast, period. Each full meal should contain a quality fat, protein, and complex carbohydrate like organic brown rice, organic quinoa, or organic sweet potato, and a source of vegetables, preferably leafy greens. Now, a good example is a homemade smoothie consisting of organic mixed greens, a half to 1 cup of cooked organic brown rice or quinoa, 20 to 30 grams of quality protein powder, not soy or whey protein powder ideally. I prefer pure rice protein powder, or ideally bone broth protein, and a fat like a tablespoon of coconut oil. And then you can add any berry of your choice for flavor, strawberry, blackberry, raspberry, or blueberry. And of course, avoid any of these if you have any known food allergies. Also, this is crucial for you at bedtime, consider a small meal as listed above. And if you wake up in the middle of the night, eat a portion of organic berries, drink a half a glass of water, don't look at your phone or TV, and go lay back down. Now next, exercise. Go slow. Eat a small snack before and after. No extreme physical exertion at all for at least the first 3 weeks. Watch out for simple chores, romantic activity, and emergency situations. Do not expect to return to full vigorous exercise for 3 months if you have adrenal fatigue. Next, sleep. You must create a healthy sleep environment. Go to your bed at scheduled bedtime, even if you can't sleep, and get up at scheduled awakening time and go into an open area. Do not just stay on the couch. Now, hydration. Do not just drink only water. You should drink at least half your weight in ounces of water per day. So if you weigh 200 pounds, you should drink 100 ounces of water per day. But you must be sure you have electrolytes in your water. These ensure hydration. Look for all natural, naturally sweetened, not sweetened with sugar or artificial sweeteners, sources of electrolytes. Stimulants, boy, you must minimize or eliminate stimulants such as coffee, nicotine, or illicit drugs. And this is crucial. You got to communicate. You are in recovery. Talk to your friends, family, talk to people at work and other doctors about what you are trying to accomplish and what your limitations are. No explosive arguments and avoid toxic people who crave conflict. If you are struggling, consider applying for the 12-week Family Medical Leave Act at work or even for unemployment benefits. Next, box breathing. This is simple. Do this morning, afternoon, and evening. The directions are inhale for 4 seconds and exhale for 8 seconds. Do this just 4 times. Do not pause in between breaths or hold your breath. And again, do that morning, afternoon, and evening. You can also do that during any time of significant stress, but we just want consistency. Now, this is important. Morning preparation and evening inventory. Upon awakening or at scheduled awakening time, determine the one thing you are most thankful for and feel that emotion, even if just for a moment. Also, list and reflect on the difficult things you have accomplished in life and attach yourself to that feeling. Also, at scheduled bedtime, out loud or under your breath, repeat I am statements for 1 to 5 minutes, such as I am healed, or I am in control of my body, or I am in balance. These mental exercises have a tremendous effect on your recovery. Do not skip these. Adrenal fatigue wears you down and makes you unfit mentally and spiritually and emotionally too as well. Make sure you exercise your mind and your heart and your spirit. This is how you do it. Do not skip this. Now, for those using supplements, use your supplements consistently. If you elect that route, be diligent, get help, get support. And for those that test, I suggest retest every 60 to 90 days if you're utilizing testing until results are satisfactory. Very important. Now I want to cover the supplement support for high or low cortisol. Remember, there is a difference between high and low cortisol recovery. Below and attached are supplement guidelines to use if you choose to utilize supplementation. Some people like to find and use their own supplements. If you need help, you can contact us for specific product support. We can help you simplify the use of supplements too so that you don't get overwhelmed. But I just want to list out now what helps low cortisol support. Vitamin B5. You might see it written as pantothenic acid. Now, you got to be sure to get at least 100 milligrams daily to benefit from it. Vitamin B6, you might see it listed as peroxidine. You need 50 to 100 milligrams daily to get benefit. Vitamin C should be taken as ascorbic acid, 1,000 to 3,000 milligrams 1 to 3 times a day. I say begin with 1,000, then increase until cramping or stool loosens, then decrease, and avoid if you have kidney disease. Zinc, 15 milligrams daily. Do not exceed 30 milligrams per day unless it's prescribed by a physician. Vitamin E should be approximately 800 international units daily. Vitamin D3, 5,000 international units daily, unless you go out in the sun with exposed skin for 20 minutes or more. Now, natural support using ashwagandha. This is a calming substance called an adaptogen. It helps your adrenals adapt back towards normal. These help in cases of acute stress, chronic imbalanced cortisol, anxiety, and chronic pain. A recommended dose is 400 milligrams twice per day. Holy basil, another excellent natural source. This helps to normalize cortisol in cases of stress. It promotes a sense of well-being. It's anti-inflammatory, and the dose suggested is 500 milligrams or 2 capsules twice daily. Now, glandulars. What a glandular is, it's an animal-derived artificial adrenal gland, actually is what it is. So it comes from an animal. It's not human. It's artificial, it's not human. But this can really help when it's just severe low cortisol output. We use anywhere from 350 milligrams to 900 milligrams daily. And again, this is an animal-derived adrenal gland, and it's very helpful for severely low cortisol levels. I suggest testing in those instances. Now, you may see something called licorice, or it's got a weird word called glycerinated licorice. It's a solid extract. A half a teaspoon at AM and a quarter teaspoon at noon can be very helpful. Understand that this is a stimulant. Just keep that in mind that this is a stimulant, as well as rhodiola. This helps acute and chronic stress tremendously, helps depression and anxiety, PTSD. This can have a stimulant effect as well. The dose is 200 to 400 milligrams per day, spread out in the morning and at noon, not later in the day. Now note, very important, do not use glandulars or stimulants like licorice or rhodiola for more than 90 days without retesting, or at least stopping for 3 to 5 days to assess for further need. Stimulants work, but just do not overuse them for long periods of time. You should not need them past 90 days. Now, high cortisol support. Commonly, we use something, big long word, called phosphatidylserine. This is usually given at night for high nighttime cortisols, which are demonstrated on the test, if you do happen to use that. This modulates cortisol, it lowers cortisol, and the dose is usually 300 to 800 milligrams daily, spread out throughout the course of the day. This is mainly used during times of high cortisol as demonstrated by testing, or if you just can't get to sleep. I suggest phosphatidylserine. Now remember, you must give your body steady blood sugar. See back to item 1 listed in the section above. Also, you must sleep 8 hours or be in bed for 8 hours at least, and do not live on the couch. As far as exercise, we suggest gentle, non-competitive exercise. Gentle. Do not do strenuous exercise for the first 3 weeks. You might return to strenuous exercise after 3 months. Now note, no glandulars, no rhodiola or glycerinated licorice. Do not take anything that states it will increase adrenal output. Now for zero cortisol support, for those who have been blood or saliva tested and the results have found zero cortisol output, you will need medical attention and will likely receive hydrocortisone, 10 milligrams at 8 a.m. and 5 milligrams at noon. Now, of course, be sure to perform zero exercise until you have moved through recovery. Now, returning to normal from adrenal fatigue is totally possible. Just remember, you're in recovery just as if you had a serious spine or brain injury. You may see progress with minor setbacks on your journey. Remember the difference between high and low cortisol. As you recover from low cortisol output, be very watchful for physical exertion and explosive emotional situations. These just set you back. Now, you may start to feel stronger and you may be tempted to engage in exercise or chores, but watch out. If you feel fuzzy, fatigued, or like you have regressed following exertion, you must decrease your intensity of activity. Your first few weeks will include no exercise. You will gradually begin walking after a few weeks. You may expect to return to full exercise within 3 months if you are diligent. Do not be discouraged by setbacks following overexertion or emotional strain. Get back to basics, be consistent, and you will turn yourself around easily. Now, your next steps. Well, you have to determine what your course of action is going to be. Now, all of these are effective, but keep in mind that advanced problems may require advanced help from trained professionals. So choice number 1 is natural recovery without testing or supplementation. We love most when we see clients apply this approach and make lasting changes. Follow the diet strategy, the rest strategy, the exercise guidelines, the home and work environmental advice, and use the breathing exercises. See items 1 through 8 listed above. Number 2, you can do natural recovery using supplementation. Now, when done carefully, this approach gives faster results and also teaches you what you might use in the future to help support you as you fight against life's stresses. And then, of course, number 3, natural recovery using supplementation and advanced testing. We know the value of advanced testing as it gives certainty about where you are. It is like a map helping you get exactly where you want to go as fast as possible. Advanced test results, professional guidance, precision supplementation, and education are most likely to give the fastest, sustainable results. But remember that the most important parts are what is found in the foundation of diet, blood sugar maintenance, proper rest, healthy sleep, the right exercise, and the creation of a minimally stressful living environment. Now, if you want help or you don't know what to do, we invite you to contact us anytime. Understand that recovery is possible, and may your journey show you an easier path of living, and may your challenges teach you how to be a blessing to others struggling who you may help to heal for good. Now, if you're still unsure about where to start, we understand. We can help you no matter where you live. Feel free to contact us to help you get started. Oh, and then if you are an official student of the Adrenal Recovery Academy, be sure to complete your quiz. And know recovery is possible. I'm Dr. Daniel Farkas. I recovered from adrenal fatigue. I know you can too.